Today, the United States kind of surpassed a sobering milestone of 600,000 deaths. Even though we are hearing from experts there's a decline in cases and there's a decline number of deaths, there are still hundreds of Americans dying on a daily basis. So my first question to you is, we are looking at reopening across the country, with California becoming the latest state to reopen fully. Is this wise to open right now, even when we are worried about hundreds of Americans being lost every single day?
Right. There's pros and cons to both approaches. I would personally like to see more people fully vaccinated and the infection rates, again, continuing to decline before going to a full reopening. But I understand, a lot of these governors have political pressures upon them. The good news is at least 70% of Americans have had at least one dose. But again, we do know people fall ill in between the two doses, and now there's the Delta variant. So ideally, it's better to wait till all of those people are fully vaccinated, but, we work within our limitations.
Right. How should people be handling these reopenings that are happening across the nation? What kind of caution should they still take?
Yeah, I think people still need to take precaution, especially indoors, and when you don't know the vaccine status of people around you. Luckily, risks are very low outdoors now that we know that. But indoors, there's still a high risk of the virus spreading. And we are still seeing people get those breakthrough cases, and majority of them occur inside, even though they're milder. So if you don't know the status of people around you, I would still continue to mask inside. And again, if you're a high-risk individual, it's okay to still mask when you're around a lot of people. There's really no downside to it, and distance as much as you can.
Dr. Parikh, last year around the summertime, we were all a little bit more happy than we were the months before. However, when fall came, we saw another surge. We saw thousands of Americans die. My question to you is, are you worried that the same will happen this fall?
Yeah, it's a real concern. We are in a little bit better position versus last summer, since we didn't have any vaccine. Nobody was vaccinated. So at least now we're heading into fall and winter with hopefully the majority of the population vaccinated, but that will depend on if all those 70% go and get their second dose. It also will depend on new variants emerging, the need for a booster. So we'll see, but at least we're in a little bit better position than we were a year ago. So that's reassuring. But fall and winter is a real threat. The flu has been around for years, right? But every flu season, except for the last one, have been very bad regardless. So all viruses surge in fall and winter.
This is happening while vaccination rates have been seen slowing down, and they're also being seen very low in several states. Most of them happen to be GOP states, or red states as we call them. My question to you is, I read in a study where it said about 29% of Republicans don't wish to get this vaccine. What will be the impact of these anti-vaxxers on us? What can it do to this downward trajectory that we're seeing of cases and deaths?
It can have a real impact, especially we've seen it occur with other diseases, right? So certain communities that are quote unquote anti-vax communities, we've seen diseases like measles outbreaks that we haven't seen in 30 years. So it can have a real impact. And a third of the population is not a small amount. So unfortunately, too, if certain geographical areas tend to be anti-vax, those areas, those infection rates can go right back up, especially in the fall and winter, like you mentioned. So that is a real concern. And that surge, unfortunately, can affect the whole country. An outbreak anywhere is an outbreak everywhere. The other problem with that, too, is the variants, right? The more the virus is allowed to spread, the more variants can emerge, which can become, difficult for our own vaccines to control. Right now, the vaccines are doing a great job of handling the variants, including the Delta variant, but nobody wants to see a variant where the vaccine is not working as well.
Right, and just talking about the Delta variant, doctor, how dangerous is this variant? And I think I read somewhere it's about 6% of US cases dealing with COVID-19. Will that number increase?
Yes, we believe it will increase because it's already the predominant variant in the UK. And now with everything opening up, people are traveling more this summer, including internationally. So I wouldn't be surprised if we see more of the Delta variant in the upcoming months as we go into summer and travel resumes.
Right, and it's just talking about vaccinations. I have a couple more questions. President Joe Biden is still hopeful for his deadline of July 4th to get 70% of the entire nation inoculated with at least one dose of the vaccine. Do you think we'll be able to reach that? And if not, what happens after that?
Yeah, I mean, hopefully his optimism is correct and we do get there because we really need that number, fully vaccinated actually, to start moving out of this pandemic. The other caveat is we need children included too, because we can't ignore that 1 in 5 cases are in children. So we not only adults, but we really need an effort to make sure 12 and up receive their vaccines too, and younger children when it's safe to do so in that age group.
Yes, and just talking about these vaccination in children, I have a couple of questions. The first one has to deal with the fact that, there is still a hesitancy or mainly a fear of these parents in inoculating their children 12 to 15. Do you think it actually affects the children in any form of development, or does it cause any issue on the body of these, adolescents?
Right. So, these studies are even more strict for children than they are for adults. And so I can say with certainty that it actually is very safe and effective in children. It doesn't cause any developmental problems. It doesn't cause, any reproductive problems. I know that's a big concern. There was a lot in the news about heart inflammation. But what everybody's forgetting is if these children get the actual COVID-19 virus, even if they have a mild case of it, then they actually are much more likely to get heart inflammation, to get developmental problems, to miss school. The impacts, public health impacts, and the impact on children's health from the real virus is still much more common than any potential threat from the vaccine, which we don't even have strong evidence that there is any threat.
Right. And Pfizer right now has started its trials in the age groups of 5 to 11. I'd like to know what insight could you provide us on that? And, the same question again, parents would be even more worried about that age group because it's so at a, fragile stage, if you may call so. So how are you looking at that?
Yeah, I wouldn't be worried. Again, age 5 to 11, we are still seeing those kids get sick with COVID-19. We're still seeing them in the hospital. People may not realize this, but 400 children have died from COVID-19, and that might seem like a small number compared to the hundreds of thousands of adults. But, for that family, it's devastating. And in my opinion, one child is too many. Even outside of that, thousands have been hospitalized, and not just for something mild. Many are in the ICU with the very severe form of the multisystemic inflammatory disorder. So if you want to protect your child, I think the vaccine is a much safer bet than taking your chances with the virus.
Right, and this brings me to the million-dollar question, Dr. Parikh, which is, should schools reopen in the fall? We are getting news that they will, and most of them will be in person. How should that look like according to you? And should they require vaccination cards? And if not, should they require the students to then wear masks? Because how would we know who's vaccinated or not?
Right. Yeah. I think, schools should reopen. Now we've been enough time that we've seen that there aren't, luckily, major outbreaks in schools, especially for elementary and high school age kids. And we know that children actually miss out on a lot, learning wise, developmentally, by not being in school. So I think they should open, and schools actually have a right to mandate vaccinations because they do for other things, because it protects not only the child, but all of the children, as well as the teachers and coaches and everyone else that works in the school. And yeah, if children refuse the vaccination, then they may have to wear masks, they may have to distance. Certain measures have to be put into place so that kids are protected. And age groups where there isn't a vaccine, I think they still need to do those measures. So if under 12 is not approved by the time school opens, I think that under 12 still needs to continue to mask and distance and take all those precautions.
Yeah, it's so important because that would be a lot of children in one place, and I'm only trying to figure out how that would look like. What do you think is lacking in our healthcare system right now? Where would you want the government or the administration to work harder on?
Yeah, I think kind of pushing vaccine hesitancy, pushing back against it, because that's really the main way we can move out of this pandemic. Luckily, we're doing much better in terms of personal protective equipment than we were, a year or 15 months ago. Our hospital resources are in better shape, but that's mostly because infection rates are down. One thing the government can do, and I know this is an unpopular opinion, but we might need to enforce some of these public health guidelines better, because I don't really see them being enforced. And I know that also varies state by state. And many people are against, government interference, but this is a public health issue where it affects others too. So in this case, it may be a good idea until more people are vaccinated.
Right. Meanwhile, a major study, doctor, has found out that nearly a quarter of COVID-19 patients have a post-COVID condition. Some of them have seen issues in their body for months after they got COVID-19. How are you looking at these long haulers, and what do they need to be worried about?
Yeah, it's a real problem, actually. Majority of people, they say, that have recovered from COVID-19, even if their illness was mild, are now experiencing a lot of long-term problems, like with their heart, lungs, kidneys. They can't concentrate. I think they said 1 in 3 have some type of neurological issue, which is very, very common. So this is even another reason why the vaccine is important. Everyone's so focused on the death rate, but everyone forgets that these people who are recovering, even very young and healthy people, are not able to work, they're not able to function, go to school, concentrate. So it's a big issue, and we don't know how long these effects will last. We don't know if there's going to be any permanent damage. Again, everybody's learning about it as we treat it. So it's a big issue. We don't have a good treatment for these long haulers either. So that's another reason, if any, to avoid the vaccine. I'm personally seeing people in their 20s, 30s, 40s, never had any medical problems, are really struggling now after their COVID infection.
Right. And, I like to know, when you're looking at these states that are now ticking up in infections, how worrisome would that be?
It's definitely worrisome because, one, again, the variants can emerge there, new variants can come about. That's more people that may potentially die, may end up in the hospital, and more people with those long COVID symptoms, which we don't know how long it will last. Is it just 1 year, 5 years, 10 years? People are still struggling who got sick in March of 2020. So it's not anything to take lightly.
Is a large percentage of current new COVID-19 cases have people that are not vaccinated? Are you seeing any trend with that?
Actually, majority of the cases, especially those in the hospital that are very sick, are all unvaccinated. So very, very few are those who are vaccinated and had breakthrough infections, but overwhelming majority are unvaccinated people, and that should tell you right there how effective the vaccine is.
Right. I have now some questions on India, doctor, our motherland, because we're still seeing a lot of devastation happen there. My first question to you is, we are seeing a decline in case numbers, but every day the death toll, and a daily death toll, goes to 3,000, 4,000, 5,000, 6,000 last week, in one day. Do you think these case numbers and deaths are being undercounted in India? Do you think in parts of rural India or tribal India, where the healthcare system lacks anyways, do you think deaths are being reported from there?
I'm sure they're being undercounted. And the reason being is, even in the US, when it was very bad early on and last winter, the deaths were being undercounted. And we don't even have as large of a population because, there's so many people who may be dying at home, who don't make it to the hospital. Like you mentioned, they're in rural areas where they don't have access to care. All of those people are not being counted. So that's a big issue. And same thing happened in the US as well when things were surging. So absolutely, I think the death toll is much higher. And going back to your previous question on things the government can do, we have enough vaccines now for every American. And if a third of people don't want them, those vaccines really should be going overseas, because it's in the best interest to protect America by making sure the whole globe is vaccinated as well.
Right. Do you think vaccination is the answer to sort of truly curbing the disease in India? And if so, how long do you think it will take? Because we are talking about, a population of 1.3 billion people.
Yeah, it's quite an undertaking. And I think it is the answer, because it's the only way, like it happened here, to slow the infection rate down enough that the hospitals are not overburdened as they are, and that the spread is low enough that people aren't getting sick as fast as they are. but it is quite an undertaking because, as you know, you're not immune the second you're vaccinated. It takes weeks, even after the first shot, weeks after the second shot. So that's the problem, that one, it just takes so long just to vaccinate one individual. And then when you're dealing with billions of individuals, you can imagine how difficult of an undertaking that is.
And meanwhile, Dr. Parikh, India has started to reopen. After strict 5-week lockdown, authorities in Delhi fully reopened shops and malls, and they're now letting restaurants have 50% capacity, railway networks have 50% capacity. We were just talking about the undercount of cases and deaths. How are you looking at this? Is this premature?
Yeah, it's very difficult because in some ways, India is in a unique situation that sometimes the lockdown can adversely affect people, especially those living below poverty, people who can't afford, to stay home, who can't afford to socially distance. But then on the other side of it, we saw that this current surge in India is a result of those lockdowns being too loose, so there has to be a happy medium, where people can still work, can still earn their livelihood, but we're not so lax, or the guard is not so down that, again, the healthcare system can't keep up, because otherwise they're barely coming out of this most recent surge, and they're still in the middle of it, if you ask me.
Right, and there's a prediction of a third wave. Only time will tell what is going to happen. My final question to you is again about India. When do you see this devastation truly calm down? When do you see the numbers coming down a lot?
I think, again, once more of the population can get vaccinated, basically what we really need is a relief and a break on the healthcare system, because right now it's so overwhelmed. That's what's causing a domino effect, because if people can't access these resources, then they're at home and they're staying home sick, right? And then as they stay home sick, that whole household gets infected, and then all those people then go on and infect more people. So if we can at least get the burden off of the healthcare systems, off of the doctors, nurses, other healthcare workers, hopefully that will cause a reduction in the whole backlog as well. And the main way out of that is, if we're not in a strict lockdown situation, is the vaccination, because if people are moving about, working, it's very, very hard to control the infection rates that way.
Yes, biggest lesson learned from this interview, go and get vaccinated. It is the only way to get out of this.
Right. Actually, there hasn't been a single infectious disease in all of history that's reached herd immunity without a vaccine, if that makes any sense. So unfortunately, we need it, whether people like it or not.